Pain flare-ups are one of the most confusing parts of recovery. Many patients start to improve. Their pain begins to settle, movement becomes easier, and things feel like they are finally heading in the right direction. Then suddenly, the pain returns. Sometimes it feels almost as strong as when it first started. When that happens, people often assume something has gone wrong. They worry they have re-injured themselves or that the treatment isn't working. In most cases, that isn't what's happening. Flare-ups are actually a common part of recovery, but they are widely misunderstood. One of the biggest misconceptions about pain is that recovery should be a straight line. People imagine the pain starting high, treatment begins, and then symptoms steadily fall until they disappear. In reality, recovery rarely works like that. Most musculoskeletal problems improve in a general downward trend, but that trend often includes temporary spikes. Pain reduces overall, but occasionally increases again for a short period. Those temporary increases are what people experience as flare-ups. They feel alarming, but they are often part of the normal recovery process. One reason flare-ups happen is a change in load. As people start to feel better, they naturally begin doing more. They move more during the day, they sit longer, they return to exercise, or they lift things they had been avoiding. Sometimes the body simply isn't ready for that increase in load yet. That doesn't necessarily mean damage has occurred. More often it means the tissues and the nervous system have been pushed slightly beyond their current capacity. Another reason flare-ups occur is nervous system sensitivity. When an injury first happens, the nervous system becomes protective. It increases sensitivity to movement and pressure in order to prevent further strain. Even after tissues begin recovering, that sensitivity can remain elevated for a while. Because of that, relatively small factors such as increased activity, poor sleep, stress, or fatigue can temporarily increase symptoms. The system is still learning that normal movement is safe again. Flare-ups can also happen simply because recovery is progressing. As movement improves, people begin using muscles and joints that may not have been functioning properly for weeks or sometimes months. During that time, those areas can become weaker or stiffer. When normal movement begins returning, those systems have to adjust again. That adjustment can temporarily irritate the area, which may feel like a setback, even though the body is moving in the right direction. A key feature of a flare-up is that it usually settles faster than the original pain episode. Most flare-ups last anywhere from a few hours to a few days. If the initial problem lasted weeks, a flare-up that settles within 1 to 3 days is generally part of normal recovery. It's also important to understand what flare-ups usually do not mean. They usually do not mean you have re-injured yourself. They do not mean the original problem has returned, and they do not mean treatment has failed. Pain is a warning system, not a direct measure of damage. During recovery, that system can sometimes remain overly cautious. When a flare-up happens, the worst reaction is panic. People often swing between two extremes. Either they stop moving completely because they are worried about making things worse, or they push through aggressively and ignore the pain. Neither approach works well. A better strategy is controlled adjustment. Reduce activity slightly for a short period, keep moving within comfortable limits, and allow symptoms to settle. Once things calm down, activity can gradually increase again. Recovery from musculoskeletal pain is rarely perfectly smooth. It usually involves gradual improvement, occasional setbacks, and steady rebuilding of strength and movement. Flare-ups are not necessarily signs of failure. In many cases, they simply mean the body is adjusting to new levels of activity. Understanding that makes the recovery process far less worrying and far more manageable.